It's 2:00. I'm Olive Martini, and this is the Working on Wellness Radio Forum, which we do the second Wednesday of every month. And my guest today is Dr. Nathan Gelder, DMD with Sequim Family Dentistry. Dr. Gelder strives to achieve the highest level of care and takes time to make sure that his patients are comfortable and well informed. In this forum, Dr. Gelder will discuss the kinds of care now available in today's world of dentistry, and he'll answer the most asked questions about current oral care and address the most common problems and concerns of today's dental patients. Welcome.
Thanks. Great to be here.
Good to have you again. So tell us a little bit, because you're a Navy veteran, and for our veterans out there, just tell us a little bit about your time as in the Navy.
Well, yeah, when I first got accepted to dental school, I looked at how much it cost, and at the time, I don't think I'd ever made more than about $8 or $9 an hour, and it completely freaked me out. So I figured I got to figure out a way to pay for this. And at the time, I had heard that the military had scholarship deals where they would pay for things, then you owed them a few years after, and I looked into it, and the Navy ended up offering me that deal, and it was actually really great. Not only did they pay for everything, which was wonderful and took a lot of stress off, but I owed them 4 years of work after dental school, so I had a job waiting for me. I didn't have to look, whereas a lot of my classmates at the final year of dental school, they were kind of stressing out about finding work, and I didn't have to worry about that at all. Went to the Navy, spent a year in California at Camp Pendleton on a Marine base. I was with the Marines all 4 years. The Navy provides medical and dental care for the Marines, and then went to a Marine base in Japan after that for 3 years. And that was really exciting and fun, and a great cultural experience. So yeah, it was just a great time to explore the world and kind of get to know what I was doing outside of school a little more with a very low pressure environment. So that was my 4 years in the Navy. I did 4 years. Told them I thought I was done at the end, and they didn't try to talk me into staying at all. And they just kind of said, "Okay, there's the door," and that was my 4 years, and it was a great experience.
Okay, well, let's just get right into it.
Okay, sounds good.
What is a root canal?
Oh,
we were talking about this. A better word for a root canal is?
We were talking. Another word is endodontic treatment, if that's a less scary term. We can certainly use that term as well.
What is a root canal?
A root canal, they've, I think, gotten a lot worse reputation than they deserve. They have the potential of alleviating incredible pain, but I think that incredible pain that precedes them is often kind of very much associated with the procedure as well. And occasionally the procedure itself can be uncomfortable, but for the most part, we get people numb and they're comfortable and we do what needs done. But in essence, what a root canal is, all teeth have nerves and blood vessels inside them that were necessary to form the tooth. But once the tooth is fully formed, they're not needed anymore. And for various reasons, cavities, cracks, trauma, they can become damaged and even infected, and essentially need to be removed. And that's what a root canal is. It's essentially drilling into the inside of the tooth, removing the damaged nerve and blood vessels, cleaning everything out really well, and then filling it in. So in essence, it's really just a deep filling.
Okay.
It goes down inside the root.
So
the tooth stays. It still looks and functions just like a tooth, but it no longer has a nerve inside.
Okay.
Yeah.
What's an implant, and are they better than a bridge?
Oh, yeah. So implants and bridges are both really common ways of replacing missing teeth. And so obviously you're missing a tooth for a variety of reasons. Implants have kind of become more the standard these days for replacing teeth. They are a titanium screw that is placed into the bone, roughly where the root of the tooth used to be. And then you can attach a fake tooth to it. You can also use them, you can attach other things, like you can attach dentures to them and other types of oral appliances as well. So they have kind of multiple uses. A bridge, those have been around a lot longer. And before implants were as good and prevalent as they are now, they were definitely the standard for replacing teeth. And a bridge, I mean, some people, most people, I'd say maybe are familiar with the idea of a crown or a cap on a tooth, which is essentially a tooth-shaped kind of shell that goes over the existing tooth. So a bridge is a crown on the tooth in front of the missing tooth, a crown on the tooth in back of the missing tooth, and then a fake tooth.
And it has like...
Or a couple fake teeth in the middle. It's all attached.
Okay.
So it's 3 or 4, up to sometimes 6 or 7 teeth in a row that are all attached and being held on by 1 or 2 on each side, and 1 or 2 or 3 or 4 fake ones in the middle. It's all cemented into place. They look and function just like teeth. Yeah. And so, some reasons why you might do one or the other would be, well, for one, for a bridge, you need healthy teeth on each side of the gap. And so if you have that, well, a bridge is an option. And there certainly are times still, even though implants are becoming more common and more widely used, there still are times where bridges make perfect sense and are still done. So if you have a healthy tooth on each side, a bridge is an option. Now, sometimes you'll be missing a tooth and you've got a healthy tooth on each side, and one or even both of those teeth, for different reasons, really could use a crown anyway, just for the health of that tooth. And so in that case, it actually kind of makes a lot of sense to do a bridge. If you're going to do a crown anyway on both the teeth and you're missing one in the middle, just make one piece all connected, and it actually ends up being only slightly more expensive than 2 crowns, and takes care of more problems.
So
Yeah.
I would assume then missing teeth need to be replaced. Why?
Well, need is a strong word. There's
Should.
a lot of people out there with missing teeth that aren't replaced, and they're still getting along all right. But ideally, in an ideal world, most missing teeth would be replaced.
I always thought that your other teeth moved if
They
you
can.
didn't.
They can shift. And that's not ideal. Teeth have a tendency to shift forward towards the front. So the most common situation I see where I sometimes don't really recommend replacement is when it's the very most posterior back tooth that comes out, and it's not visible. It's the person's maybe losing a little bit of chewing function, but not that much. And I tell them, let's just take it out, let it heal, see how you feel without it, and we'll talk. And a lot of people in that situation where it's the very most posterior tooth, after a few months or a year, they say, you know what? I don't even notice it. It's like it never was there. And they're fine. Every now and then I get people that a year later, they're saying it's driving me nuts because I used to chew back there all the time and I have nothing there to chew with now and I need that extra chewing function. And we say, okay, then let's replace it. And since it's the most furthest back tooth, there's no tooth behind it to attach anything to. Bridge isn't an option. An implant is almost always the way to go.
Okay.
And so we put an implant in and it's great. On the topic of implants too, kind of going back a little bit, in order to do an implant, you need enough healthy bone to put it in. And most of the time we can find the bone we need to attach an implant, but there are times where we can't, because the tooth that was there ahead of time maybe had become so infected and the infection had deteriorated that bone. By the time it came out, there's just not enough there. When teeth have been missing for quite a long time, the bone naturally kind of dissolves and degrades anyway. So sometimes somebody's been missing a tooth for many, many years, and then all of a sudden they decide, I want to get this tooth replaced. And we go and we take some x-rays and scans and realize, oh, geez, I'm sorry, but the bone has degraded so much, you just don't have enough there to put an implant in. And in that case, we're talking bridges, possibly, or another tooth replacement option that we didn't really discuss, along with bridges and implants, is something removable, like a removable partial denture or full denture, but something that comes in and out. And sometimes for a variety of reasons. People don't have the bone. They don't have a tooth in front and back of the space. Then all of a sudden a partial denture becomes the only option. And so those still are options too. They're quite a bit less expensive, which is nice. They tend to be a little bulkier and more uncomfortable. Food can get under them. There's things that aren't ideal about them. But a lot of people, learn to live with them and actually really appreciate them. And there's a lot of people out there that use those as well. So those are kind of the three main options for tooth replacement.
Well, here's a good question.
Okay.
What if you fall and a tooth gets knocked out? What's the first thing that you should do if you can't get to the dentist immediately? What should you do? If you knock out a tooth, what should happen? Like if you've got kids that play football or you've fallen and you've knocked out a tooth. Yeah. That happened to my sister-in-law when she was walking the dog. Yeah. So what do you do if you can't get to the dentist immediately?
Yeah, so if you ideally want to see if that tooth maybe could be saved, and sometimes they can, just keeping them moist. I've heard a lot of times like milk is a way to keep a tooth moist.
Drop it in milk.
Yeah,
okay.
and it has a lot of the same nutrients and the salt concentration and things like that that's in our body naturally. So it tends to be, very healthy for the tooth, until you can get to a dentist and maybe get it put into, sometimes they can be put back into the socket, stabilized a bit, time can go by, and they can actually kind of reattach.
That's what happened to her.
Yeah,
they were able to save
happen.
it. Yeah.
Something to keep in mind too, though, is that could be done with adult teeth. It usually is not recommended for baby teeth.
Okay.
And that tends to be who knocks teeth out a lot too, little kids. And so it's not usually recommended to try to put baby teeth back in.
Okay.
Yeah.
So let's talk a little bit about gum disease and how you get it.
Yeah, that's a good topic. It's very prevalent. Some people, I see reports sometimes that estimate up to 80 or 90% of adults, say 60 and over, have some degree of gum disease. And like any disease, it can come in lots of severities. But it's absolutely a disease of age. It's very rare to see significant gum disease in somebody's teens or 20s.
Okay.
It's very common. 60s and 70s, again, a large portion of the population has it to some degree. It's very genetically regulated. And so some people just, the genes they were born with, they are going to be a lot more prone to it. Other people, not so much. Hygiene, how well you take care of your teeth, plays a big part. So even if you're a person who knows, like both my parents had really bad gum disease, they lost their teeth because of gum disease. Well, if you really get on the ball with keeping really good care of your teeth, brushing, flossing, regular dental cleanings, you can absolutely still combat it. It's important to remember that it almost always tends to take hold in between, usually the back teeth.
Okay.
And so flossing around those molars is super important. Other things like diabetes and other, health-related issues absolutely are correlated. Smoking. If you are a person who has a family history and you're a smoker and maybe you even have diabetes, you start getting that many things stacked up against you, you pretty much are going to have gum disease.
Okay.
But, some of those things are within our control and some aren't. So, but essentially what gum disease is it's the gum and bone that are holding the teeth in can actually start breaking down and slowly detaching from the root. And obviously, if that happens to a large enough degree, those teeth are going to start getting loose. They're going to start becoming infected. When it gets to its advanced stage, people are getting gum infections. They're uncomfortable, obviously very bad breath. And start losing a lot of teeth.
What about fluoride? Is fluoride safe?
Fluoride has been shown to be very safe. There's been a lot of studies done on it. mostly a long time ago. And that's sometimes criticism I see about fluoride, is that there hasn't been any recent research. And I think the reason is just because it was so clear a long time ago with all these studies that it was safe. They kind of stopped studying it. There's lots of research money needed for other things too. And so there isn't a lot of real recent research on it. But the research that was done a long time ago showed it to be very safe and very effective if it was done correctly, as far as the right dose. And
yeah, they're talking about taking fluoride out of the water. And so if that happens, then a fluoride treatment would be better than none at all. Am I right?
Well, yeah. And the other thing to kind of keep in mind with fluoride too, though, is it's so much more prevalent in so many products these days. It didn't used to be. So it's in essentially all toothpaste.
Okay.
You have to really look for a toothpaste that doesn't have it. And so it's going to be in that. If you drink any kind of bottled water or bottled juices or bottled soda, a lot of times those are bottled in places that have a fluoridated water system.
Okay.
So a lot of those actually have fluoride in them also, and people don't even realize it. And so anyway, there's lots of different mouth rinses now that have fluoride in them. So it's easier to get fluoride these days than it used to be.
Okay. What about what causes dry mouth?
Well, a lot of things, but dry mouth, definitely. We were just talking about gum disease, kind of being a disease of aging. To some degree, dry mouth, as people get older, salivary glands do produce less. So to some degree, as you get older, your mouth does dry up. Also, there's a lot of medications out there that have dry mouth as a side effect. And again, as people get older, they tend to take more medications. And so it's something I see and hear about a lot more, is people dealing with dry mouth. And saliva is super important to the health of our mouth. It is our number one defense, really, against cavities. Your teeth are constantly getting bathed by saliva. And if that stops, sticky plaque and sugars and things that would normally just be kind of like rinsed off continually are not getting rinsed off. And if the dry mouth gets bad, people can all of a sudden be prone to cavities really quickly. I've seen people. The other thing that can cause dry mouth, I didn't mention, certain types of cancer treatment can definitely cause dry mouth as well, and that can be pretty extreme also. So I've seen so many people that have gone their whole life with relatively little decay, and then they're a year or two into a certain type of cancer treatment, and the medications they're taking with that, and the chemotherapy, and all of it. They've got a cavity on every single tooth.
Really?
It can happen quickly and severely. So obviously, if that's something that your doctors usually will kind of talk to you about before that kind of treatment. Certainly, if you know you're going to be getting some kind of treatment like that, be good to talk to your dentist at that time too, just to be talking about what to look out for, what to do to help prevent things. Sometimes we'll put people on a extra strength fluoride regime because that can really help battle that. And then there's other products that can kind of help moisturize the mouth, kind of imitate saliva.
Okay, so water wouldn't...
Water absolutely is
Yeah?
part of the solution.
Okay.
Yeah, sipping little bits of water, but there's other products also, like I said, extra, Yeah, but that dry mouth can really kind of wreak havoc in the mouth for sure.
Okay. My guest today is Dr. Nathan Gelder. He is a dentist with Sequim Family Dentistry. He's actually also my dentist. And we've been talking about tooth decay and all things like that. And he's going to tell us a little bit about why some people grind their teeth.
Yeah, so I would say actually pretty much all people do grind their teeth to some degree in their sleep. It's just part of going through natural sleep cycles. You go through certain cycles in your sleep, and it's just natural to grind your teeth. It's often a quick little 3 or 4 second grind that just happens periodically throughout the night, and that's actually super normal. There are people, though, that do way more. Hours upon hours of hard clenching grinding at night. The other thing that happens at night, we were just talking about dry mouth.
Yeah.
And so it's super natural throughout the day to actually salivate more in the daytime and then for your mouth to dry up at night. And so at night, that grinding becomes even more harmful because the teeth are dry. There's more friction. And the teeth are almost become a little bit like sandpaper on each other at nighttime. Whereas during the day, and you've got saliva in your mouth, it's slippery.
Okay.
And they just kind of slide across each other, and it doesn't really cause a lot of harm. But at night, that grinding can really start wearing the teeth down significantly. And so that's why, it's normal and natural to some degree. But some people that do it just way too much, you'll start seeing after years and years of doing that, significant amounts of wear and tear. I mean, I've seen people that have worn their teeth over halfway down. There's just sometimes almost, I've seen people actually just sometimes almost grind their teeth down to the gum line.
No.
Yeah. I mean, it can happen. Yeah. And that's after
and they're unaware of this?
They're aware,
okay.
but it's, it gets to the point where, it's often not painful. And, it gets to the point where the fix can be extensive and expensive. And they're just kind of aware of it.
So are you pulling those teeth and then putting in dentures? Is that what you're doing?
Sometimes that is the only option in very extreme cases. Other times we're talking often about crowns, like we talked about earlier in the show. But when it's due to wear like that, you can't just do one or two teeth. You got to do usually all the teeth in the whole mouth. And that becomes a big, expensive project.
So when you are seeing your dentist twice a year, like you should, and your dentist says, gee, I'm seeing some wear here, and you suggest what?
Most of the time, what I suggest when I see wear that to me looks excessive, and excessive wear, varies a bit. Excessive wear in a 20-year-old is going to look different than excessive wear in a 50-year-old or an 80-year-old. So I take that into account. But yeah, if I see wear that I'm like, that looks more than there should be, a night guard, which are quite common, and dentists make them all the time. They're custom made, and they're usually fitted just a lot better, more evenly. They're more comfortable. There are over-the-counter night guards that you can get yourself too, and those tend to be bulkier because they're kind of a one-size-fits-all thing. But if a person can wear one of those comfortably, it's absolutely better than nothing at all if they've got a grinding issue. And obviously, the advantage to those is they're less expensive. But yeah, if you're concerned about tooth wear, and you haven't talked to your dentist about it, you might want to bring it up. But it's something that dentists are pretty accustomed to looking for and talking about too. But yeah, it absolutely can become way out of balance and wear teeth down a lot. Yeah.
And here's a question that I think I ask you every year.
Oh, okay.
Because I think
Let's
it's
ask
so
that question
interesting. Is when you go to the dentist and they're checking your gums for receding gums and that kind of thing, and they do like the numbers.
The numbers, yeah.
And so they're actually going above each tooth, and talk a little bit about that.
Sure. So, that goes right along with, we were talking about gum disease earlier before the first song. And that's a key measurement of gum disease. Those pockets that we measure are essentially measuring the distance from the gum where you see it to where that gum actually attaches to the root of the tooth.
So you have to lift it just a little bit? Is that what you're doing?
Our instrument that we use to measure it is very thin, and we just kind of slide it gently.
See. You can't.
Although it doesn't always feel gently, but we try to be gentle. You slide it. It's a tiny little ruler that we slide up under the gum. It has little markings on it.
Oh, there's markings on
tiny little markings.
Really?
Yeah. Oh, yeah. And depending on how many little marks go up, we know that pocket depth is 2, 3, 4, 8, 10 millimeters deep. We like 3 and less because you can get up 3 millimeters under the gum with brush and floss and water picks and all these things.
Oh, okay.
And clean quite well. 4 is kind of borderline. They're not great. They're not horrible. 5 and up, we start getting more concerned with. 5s and 6s are not great. 7s and 8s are getting pretty bad. 9s, 10s, up into double digits. you're getting real close to losing teeth and having pretty severe infections.
So, now that is not something
If you
that
haven't
I-
already,
Yeah.
actually, by that point.
Yeah.
But yeah, so it can get all the way into double digits.
So if you hear like
Yeah.
1, 2,
1, 2, 3s,
1, 2,
you're
3.
golden.
Yeah.
That's just what we want to hear.
excellent.
4s, 5s, 6s, not so great. 7s and up, you got problems. And that's, we talked about with gum disease, how it comes in different severities.
So
Yeah.
let's talk a little bit about flossing. And so some people like the floss that comes in the string.
Yeah, big long spool, sure.
Yeah, and other people have a hard time with that. And it's more than just going in between teeth. It's sliding that on the sides of the teeth so that you're getting that off, right?
Exactly.
So
Scraping the plaque off.
Yeah, talk a little bit about that.
About flossing technique?
Yes.
Yeah, sure. Well, just like you
If you don't
mentioned.
like the string, what do you suggest?
Well, there's those little picks that are little plastic picks that kind of, have just a tiny amount of floss strung between two parts of the pick. They come in little disposable ones, or you can actually buy bigger, longer ones that are closer to the size of the toothbrush, where you actually kind of wrap your own floss around them and use them, and then you can change it out as it breaks or gets dirty. They all work. I mean, the most important thing is that you're getting something in between your teeth and removing the plaque. And floss is a great way of doing it. You can actually get down under the gum line. Ideally, whether it's a little device that's holding the floss or your own fingers, once the floss gets around through the contact point, you feel it kind of snap down, you want to wrap it around the tooth to the front and scrape it up and down a few times, and then wrap it around the back one and scrape it up and down. You're trying to scrape off the plaque.
Okay.
Along with floss. I mean, floss is great. It's kind of the gold standard for keeping things clean in between your teeth. Absolutely recommended. But in addition to floss, or sometimes in replacement of floss, if you just can't get yourself to be a flosser for one reason or another, there's the little picks that go in between your teeth. Some of them have they're tiny little like bottle brushes that go in between the
those
teeth.
are the ones I like.
Yeah, and those, I mean, those are actually quite effective also. Anything that gets in between the teeth and cleans stuff out. Water picks are, becoming much more readily available and talked about. They do a great job too. They sometimes don't remove the plaque quite as well, but they do a great job at getting chunks of food debris and things out. So like under bridges, like we were talking about before, or around implants. Sometimes those are a little more difficult areas to keep clean. There's a little more space sometimes that gets food stuck there.
Okay.
Water picks can be great at blasting out chunks of debris. Yeah.
What is oil pulling?
Oh, yeah, that's a good one. I've been hearing more about oil pulling lately from patients, and essentially it intrigued me. I had not heard about it. Well, I heard about it a while back, and it's interesting how things on the internet kind of resurface, because I heard a lot about this a decade or so ago, and at that point I had to look into it because I'd never heard of it. And then it kind of went away for quite a while. I didn't hear much about it. And then the last year or two, I've been hearing about it all over again. But it goes way back. I think I read maybe back into ancient like India and things as a way of cleaning the teeth, swishing with oil. And the way it's commonly kind of promoted, and it like I said, it has its rounds on the internet, people promoting, various things, for all kinds of health reasons, right? That we're blasted with that all the time on the internet. Coconut oil is the most common thing. So you take a tablespoon or so of coconut oil, and it melts at a very low temperature. So you put it in your mouth, and within a short time it's melted, right? And you swish it really vigorously through in and out your teeth. And the thing that amazed me is I was hearing at times of anywhere from 15, 20 minutes up to an hour. I couldn't fathom doing that myself. Your muscles would be so incredibly sore.
You leave it in your
You're
mouth?
in your mouth for 20 to 60 minutes, and you're just constantly vigorously swishing melted coconut oil through your teeth. And then after that amount of time's lapsed, obviously you spit it all out. And the theory is that it will have not only pulled out all kinds of horrible toxins out of your mouth, bacteria, things like, but it almost, my understanding is some people that are promoting it are saying it can actually, the longer you do it, it can almost be like a vacuum and be pulling toxins from elsewhere in your body. So, and you're just spitting them out. So if you do it every day, they say it's a way of pulling out just all kinds of toxins out of your body and making you incredibly healthy.
And so they're saying that coconut oil is preferable to like olive oil
That
or something
tends
like that?
to be the one that's recommended most often.
Okay.
Yeah, from what I've heard. The little bit I've looked into it, I can't find a single scientific research article promoting this or proving that it does anything wrong. I always tell people I can't imagine that it's harming you.
Right.
Other than I would think for that amount of time, and I guess over time, those muscles will be built up significantly. But the first week or two you're doing, I think you're going to have a really sore mouth swishing that long.
What's the, is it TMJ? What is that?
That's the temporomandibular joint. That's the hinge right in front of the ear that the lower jaw kind of hinges on. Yeah, the joint and all the muscles around that joint, I would think just swishing and moving could kind of get sore. But I don't think it's hurting anyone. But at the same time, I've not seen any research out there showing that it's helping people. And what I have come across with oil pulling is people that have come across it on the internet convinced that it is going to take care of everything that ails them, at least in the mouth, maybe even outside of the mouth. And they'll rely on that, and they'll do that for months, years, in lieu of going to see a dentist. Mm-hmm. And so then they'll come in to see me because all of a sudden something's really hurting. And I'll do my exam and I'll tell them, you have an abscessed tooth, or you have severe gum disease, or you have something like that. And here's what we need to do to fix it. And they often are in complete disbelief that they could have anything wrong with their mouth because they've been pulling oil for 40 minutes a day for the last 3 years. How could they possibly have this problem? Because it says right there on the internet that exactly that this will take care of the issue. And so I've seen it kind of mask a lot of issues, or people are kind of lured into thinking as long as I'm doing this, I'll be fine. So it does. So if there's any harm in it, I would say, I guess false hopes.
Yeah.
Maybe.
Don't give up the dentist just yet.
But if people read about it and want to give it a try, in addition to seeing their dentist regularly and brushing and flossing regularly, and I doubt it's going to hurt anything. There's all kinds of things on the internet that come up like this. Lately, the last couple of years too, I've been seeing a lot of charcoal-based products, charcoal toothpaste, charcoal toothbrushes. So the toothpaste and the toothbrush bristles are black with activated charcoal. And activated charcoal, you see it in like water, like Brita water filters and things.
Yeah.
And it supposedly pulls toxins and minerals and things out of the water. So that's, I think, kind of the idea is if you brush with this, it will help pull these toxins out of your mouth. Again, no research whatsoever. It's often a little more expensive.
I'm kind of making a face right now.
You get the regular toothpaste for, $5 a tooth, but you can get the charcoal toothpaste for only $8 a tube, and it's just so much better. Well, the toothpaste company, if they sell enough of those, they're making however much more money.
Well, talking about money,
yeah.
Should I buy dental insurance?
Oh, that's a good one. Yeah. And that's something that I've been seeing a lot more of too. Dental insurance companies marketing straight to the consumer. It used to be the main, obviously, way you got dental insurance was through an employer. But lately, I've been seeing a lot. I even get them in the mail at my own home, postcards.
Yeah.
Saying, here we've got all these great dental plans. Do you have dental insurance? You should buy dental insurance. And the thing to remember is these dental insurance companies are private, for-profit companies. I mean, their ultimate goal is making a profit. It is unfortunately not to actually help their consumers. So what we found, and have done it so many times with people that have bought these policies on their own because they felt, I don't have dental insurance, I should get dental insurance. A lot of people, grew up having dental insurance all the time through their job. They got retired in the last few years, maybe 5 or 10 years ago, and maybe they dropped off, not going to the dentist as often, and then all of a sudden they get this postcard in the mail. Oh, would you like dental insurance? And so people have started buying these policies a lot more. And what we found is when people come in and actually show us how much they're paying in monthly premiums, and then we actually will look up and show them, so like in a year policy, how much that insurance company has actually paid in dental work. I can't even think of a situation to where the dental insurance company has paid more in dental work than the person paid in premiums. Almost always they're paying more in premiums than they are, getting in dental benefits.
Okay.
It's usually not an extreme amount, but it's, over the course of a year, maybe they paid $200 or $300 more in premiums than they got in benefits. And again, they're for-profit companies. They've worked it all out. They're not there to do you a favor. So what I usually recommend for people is if you're paying the premiums yourself, you're usually better off to just set some money aside and go to the dentist directly. The other huge advantage of doing that is that you're not beholden to the company approving treatment. There's so many types of treatment out there that are absolutely needed and beneficial that the company will not pay for. And again, the more they deny, the more money they end up keeping for themselves. And so it's just so much more flexible if you're working straight with your dentist on things and not relying on the company. Now, if you've got an employer that's willing to pay the premiums for you, or a deal with maybe a past employer and they're being paid anyway, absolutely take it. It's a wonderful deal and it'll help pay for things. But if you're paying the bill yourself, it almost always is better just to go straight with your dentist. A lot of dentists, myself included, have deals to where if you pay cash, you get a little bit of a discount yourself. And so that can be helpful also. But yeah, it's something I'm seeing a lot more. And I think these companies have realized that, there is a profit to be made if they actually start marketing direct to the consumer versus just marketing to employers, which is kind of what they did in the past. Now, yeah, it's become a really significant trend lately, and one that I'm not sure is always benefiting people.
Do I need a dental exam before surgery?
Yeah, that's a really good one, and that's becoming much more common these days, especially for joint replacement. Also, probably the second most common reason I see is for various type of heart surgeries. But those, especially those artificial joints, are a lot more susceptible to becoming infected. And so it's just natural and common that occasionally bacteria will get into your bloodstream. Our immune systems are great, and usually they just kill those bacteria right away, and we don't even know what happened. If you have a dental infection, and sometimes those infections are kind of silent infections that aren't hurting at all, or that maybe bother you a little bit off and on, but just about by the time you're ready to do something, they go away, and people just they don't realize they have one. They continually leak little bits of bacteria into your bloodstream. And like I said, your normal body can just kind of handle that most of the time, but those artificial joints are much more susceptible. And so that little bit of bacteria that's leaking into your bloodstream can actually colonize an artificial joint and cause it to become infected. And the whole thing has to be taken out and redone. And so, yeah, that is a really common thing they're requiring more and more now, is before you have a procedure like that, they'll have you go to your dentist and get a full exam done and make sure that you don't have any of those, especially those silent infections. Of course, if you already know you have an infection, that's something that needs to be dealt with too. But occasionally it'll catch people by surprise. They'll come in and we'll do the exam, and the x-ray will reveal, oh yeah, you have an abscess tooth and you need a root canal, or you need the tooth pulled to get rid of the infection.
Before surgery.
Before the surgery. And it's worth noting too, if you've got something coming up, just to maybe ask your surgeon or the preoperative team ahead of time if that's going to be needed. They feel it's really important, but I think they're busy people. There's lots to talk about and do, and sometimes I feel like this topic doesn't get brought up until like the preoperative appointment, maybe a week or two before the surgery. And if people aren't already up on regular dental care or don't have a dentist, that can be a big hurdle to get something like that done in just a couple of weeks' time, especially if there's a problem found.
What do you have to do for patients that, do you have to treat them differently if they have diabetes?
Well, diabetes, definitely.
Like if you have to do oral surgery or anything like that?
So it will make people heal more poorly in just about everything in their lives. And so, if we're doing a procedure, surgery, it's, we know that it definitely could take longer to heal.
Okay.
With someone with diabetes, we might have to put them on antibiotics, whereas we wouldn't with someone else, or maybe a little longer on antibiotics. Like we talked about at the beginning of the show, it's definitely associated with gum disease more. And so if somebody has diabetes, we're going to be a little more diligent about really keeping on top of their gum issues. By the same token, if you have active gum disease and diabetes, and you get the gum disease really treated and under control well, it can actually really significantly help the diabetes and the glucose control. We see it all the time.
Okay.
Yeah.
So what are common dental decay risk factors?
Yeah, so we talked about dry mouth earlier, and that's a huge one. And so, again, just dry mouth for all kinds of reasons, medications, cancer treatment, things like that. A huge risk factor for decay. Snacking. Sugary things, of course, but also things people don't think about as necessarily sugary. Just almost anything with carbohydrates. Bread, crackers, anything like that can break down into sugar.
Popcorn.
Really? Yeah. Yep. All that stuff can get broken down into sugars really readily and easily with the saliva will break it down into sugars. Particularly, and with sugary things or carbohydrates, it's not so much the total amount, but it's the frequency.
Okay.
And so if you have, say, a candy bar and you eat the whole thing in 15 minutes, ideally you brush or at least rinse afterwards, you've done almost no damage to your teeth. That same candy bar, a bite every 15 minutes for a couple hours, it's all about the amount of time those teeth are exposed to the sugar. That is doing a whole lot of damage.
Okay.
Yeah. Also, the timing of the snacks. Snacking right before bed.
Yeah.
And then not brushing afterwards. I mean, that stuff's just in your mouth and then, like we talked about, again, dry mouth, going to bed, the salivary glands dry up, and you've got a little sugar coating on your teeth, your saliva goes away. We see people that get into these habits that had a long history of very healthy mouths can go downhill quick.
Wow.
With weird little changes in habits like that. So those definitely can put you at higher risk for decay, for sure.
Well, I want to thank you so much for coming in again and talking to us about teeth. The Dungeness Valley Health and Wellness Clinic provides this service the second Wednesday of every month, and it's called WOW, Working on Wellness. And Dr. Gelder's been here before, and hopefully we can talk him into coming back. The Dungeness Valley Health and Wellness Clinic is open to the public on Monday and Thursday evenings. The doors open at 4:30 p.m. and no appointment is necessary. The Sequim Free Clinic is here to serve anyone who has no health insurance or is underfunded. And another thing that the clinic does is they provide dental vouchers for those people that can't afford to go to the dentist. And so it's a possibility, if they've got vouchers available, that you might be able to see a dentist in our area. And I know that Dr. Gelder is one of those dentists that provides care.